House. And I want to briefly introduce Mike Drumgoole. He's the Deputy Director of South Texas HIDA, and Lance Sumter, the Director of Texoma HIDA. There's 33 HIDAs across the country, and there's 4 HIDAs in Texas. And if you want any more information, we'll be around afterwards for any information on the HIDA program. And represented here, you have the Houston HIDA Executive Board that is comprised of 10 state and local and 10 federal agency heads here in the greater region. Our HIDA region goes all the way from Louisiana down to Brownsville along the coast. And I think it's gonna be very enlightening about the problem that we have here. And we also have the great support of our 2 Texas senators, Senator Cruz and Senator Cornyn. Senator Cornyn actually has a representative here today, and we actually get great help from the senators addressing this problem. And there was just Jay, actually, I'm going to introduce Jay Guerrero, but the senators and the House just approved a bill yesterday really helping law enforcement curtail some of the precursor chemicals that is producing this deadly substances in labs in Mexico. And with that, I'd like to introduce Jay Guerrero.
Thank you, Mike. Well, Senator Cornyn is former Attorney General here in Texas and Supreme Court Justice, and is very involved up in Washington on these issues. He wishes he could be here, but he sent me here with this letter. The letter is directed to the Houston high-intensity drug trafficking area, but then also, as Mike mentioned, the South Texas, Texoma, and West Texas HIDAs are also very involved in making this happen. But the letter he sent says, I want to thank Houston High-Intensity Drug Trafficking Area for their work to launch the One Pill Can Kill advocacy campaign. This effort, along with the continuous work to fight the root causes of the rise of drug overdoses in the greater Houston area, is greatly appreciated. The recent milestone of 100,000 Americans killed in a single year by drug overdoses, many of them by fentanyl, must be swiftly addressed. In launching efforts like this, it's clear that Houston HIDA and their partners will help raise awareness about the alarming increase in fentanyl and fentanyl-laced drugs. The damage being done to communities and families all across the country is far too devastating not to have such a strong response. As I work on legislation in Congress to crack down on the flow of deadly drugs entering the United States and punish those involved, I will keep in mind the testimony that Houston HIDA Director Mike McDaniel shared with my Senate colleagues earlier this month in Washington. I'm grateful for the commitment to the region that Houston HIDA and its members carry out each day. Again, thank you for your work here today and to make a difference in this unfortunate chapter on the war on drugs. Signed, United States Senator John Cornyn. Thank you.
Good morning, everyone. My name is Jason Taylor. I'm the Regional Director for Texas DPS, and I'm also the Chairman of the HIDA Executive Board for the Houston HIDA, represented here today. So fentanyl is an indiscriminate killer. It's coming to Texas at an alarming rate. In less than 12 months last year, our DPS crime labs took in over 500 submissions of fentanyl. We've also seized, DPS only, in a 1-year period, 288 million lethal doses of fentanyl in Texas. So this drug is used, as you know, to counterfeit pills which contain toxic levels of fentanyl that are killing Texans. So the Texas Department of Public Safety has troopers seizing the substance roadside, special agents conducting long-term investigations, many of those assigned to HIDA task forces. And they've seized, like I stated, large amounts of fentanyl, and also the pill presses that these dealers are using to make the pills here locally. Through Operation Lone Star, through the governor's office, troopers, agents, Texas Rangers, and pilots have assisted in seizing large amounts of fentanyl along the Texas-Mexico border. But we do not seize it all. So the department's efforts to end this fentanyl crisis doesn't stop at the seizure of drugs on the highways or in our cities. Drug dealers who kill users by putting lethal doses of fentanyl in counterfeit pills and selling them to unsuspecting buyers should know that DPS special agents, our partners here, are doggedly conducting investigations beyond these roadside stops and beyond these seizures to put these individuals in jail and bring them to justice. So though law enforcement, HIDA initiatives, and other organizations are doing an outstanding and at times a very dangerous job to keep the Lone Star state safe, we also need citizen involvement to provide us with information on these dealers and where we can locate them, what we can do to take them down. So we need the citizens' involvement. You can contact Crime Stoppers, use apps such as iWatch Texas to report suspicious activity, and law enforcement will follow up on these leads and bring these individuals to justice and most likely save some lives as well. So today, the One Pill Can Kill campaign is another step in the criminal justice endeavor to stop fentanyl from harming our loved ones and destroying lives, and I'm honored to be a part of it, and I'm glad that HIDA is leading the charge. So in closing, I'd like to say that this is not political, it's not opinion, it's not posturing, this is reality. One pill can kill, and we're going to do all we can to end this, this tragedy affecting our state and our cities and our whole country. Thank you very much.
Daniel Cuomo, Drug Enforcement Administration, Special Agent in Charge. This billboard program is very important. Look, all of us up here, we work together all the time. It's very easy for us, and we're very good at putting people in jail. One thing that I want all of you guys to know, that what's important right now is that we educate and we put out awareness to all the citizens of Texas that it's not just about putting people in jail. It's about educating the community. It's about the awareness, letting you know the dangers of fentanyl. Right now, we have a 45% increase already. We're not even midway through the year. There's already a 45% increase of fentanyl that we're taking off of the street. It's way too much. Here in Harris County, fentanyl already has passed, or last year, has passed overdose for cocaine. So clearly, this fentanyl problem is very significant. These fake pills, counterfeit pills, terrible. The Mexican drug cartels don't care about lives. What they care about is money. They care about profit. We need to make sure that all the citizens are aware of this. They know this. They're not worried about just getting you high. They're worried about making money. So with that being said, we're going to continue to work as a group, shoulder to shoulder, standing together to make the citizens of Texas safe. And always remember, one pill can kill. Right now, you can go out, take one pill, and your life could be over with. Thank you.
So good afternoon. I'm Ernest Garcia, Assistant Chief of the Houston Police Department. And on behalf of Police Chief Troy Finner, I want to say that the Houston Police Department welcomes the opportunity to work with our partners here that you see. It's always a collaborative effort between law enforcement, state and federal, as well as the criminal justice system. But as some of them has said earlier, it is the community also involvement that we can get a hold of this tragedy, this incidents that are happening with the pill overdose. The Houston Police Department again is welcome the opportunity to work with our partners, and anything that we can do, we're here to help any way that we can. So thank you very much.
Good morning, everyone. My name is Dana Carter. I currently serve as the Assistant Inspector in Charge, Houston Division, United States Postal Inspection Service. Here today, I think that we're doing something a lot bigger than our enforcement actions, a lot bigger than making arrests. We're coming together with our partners to actually embark upon a strategy, prevention, awareness. Today is about education. Today is about bringing to light some of the consequences, or the ultimate consequence, that can happen when one of our loved ones, one member in our community, one of our children, one of our cousins, makes an unfortunate decision to take a fake pill. For decades, law enforcement has been fighting drug epidemics. It is definitely an uphill battle which constantly changes and requires a community, as well as law enforcement, to come into partnership, as we are today, to truly have an impact. Fentanyl, as was spoken earlier, is definitely one of the leading causes in deaths when it comes to narcotics and poison, toxic substances, which are definitely impacting our nation. I stand here today united with our partners, again, to raise awareness of the very real consequence associated with the use of fake pills that contain fentanyl. A part of the Postal Inspection Service's mission is to defend our nation's mail system from illegal or dangerous use. This means that postal inspectors will not stand by idle and watch the mail system be used as a facilitator for transportation of illegal contraband and narcotics, especially one such as fentanyl, which can be so dangerous. And to keep echoing our slogan today, and one pill can kill. Not only does poison not belong in our communities, not only does it not belong in the hands of our loved ones, in the hands of our children, it also has no place within the mail system of this country. Postal inspectors here in the Houston Division and across the United States work closely with our federal and state partners to remove any type of illegal substance from the United States mail system. Anyone, drug dealers, anyone using our nation's mail system to traffic fentanyl or any other dangerous drug will be sought and prosecuted with the help of the United States Attorney's Office. One pill can indeed kill, and anyone making the horrible decision to traffic fentanyl by way of our nation's mail system will be held accountable. Thank you.
Good morning, everybody. Paul Fortenberry, the Harris County DA's Office, Bureau Chief of the Trial Bureau. We would like to take this opportunity to thank Mike McDaniels and Houston HIDA for their efforts in raising awareness with regard to fentanyl pills. This is a people issue. This is a law enforcement issue, but it's also a community issue. Last year, we had 466 deaths at the hands of fentanyl. And this is a dramatic increase over what we've seen in the past. And so what we're trying to do here today is raise awareness for that issue. So, to teenagers out there, to middle schoolers, to high schoolers, to college kids, you must know that the pills that you buy on the streets and that you get from your friends oftentimes contain fentanyl. They may look like Oxy. It may look like Xanax, but there is a very good chance that you are playing Russian roulette when you take that pill. The main thing that needs to be emphasized is that the only pill that someone should put in their body is one that comes from a pharmacy, because that's the only way that we know that that's a safe pill. To parents in Harris County and the surrounding communities, have conversations with your children. You may believe your child is not the type to ever buy or take a pill from another person, but I've heard lots of stories from many parents who felt the same. It's important to have these conversations so that your child knows that pills bought on the street are dangerous and they likely contain fentanyl. They are not from a pharmacy. And that taking one pill can in fact kill. To those that traffic these horrible substances on our streets, to our children, and to others in our community, in July of 2021, Governor Greg Abbott signed Senate Bill 768 into law, which enhances the penalties for manufacturing and delivering fentanyl. And the minimum penalties now are for delivering 1 to 4 grams of this dangerous substance. That crime is enhanced to a second-degree felony. 4 grams to 200 grams makes that case a 10-to-life case. And for those that deliver more than 400 grams, you're talking about 20 to life. And so the penalties have been enhanced. The drug dealers out there, those that are involved in manufacturing and delivery of these substances, they already know. They know that one pill can kill. And so they are aware. and there will be penalties and there will be accountability for those that we're able to catch. Additionally, the amount of fentanyl in one pill, a fatal overdose amount, is 2 milligrams. So that you have understanding of that, a packet of sweet and low sugar has 1,000 milligrams. So when we're talking 2 milligrams as the fatal overdose amount, if you divide that sweet and low packet by 1,000 pieces and you get 2 of those, that's what will kill, right? 1 will make you high, 1 milligram. 2 or 3 milligrams kills you. And so the threshold of death is very thin. It's not pharmaceutical companies making these pills. It's criminal street gangs. It's drug trafficking organizations. They're the ones making these pills. They're making them in warehouses and in labs with no controls. And so that's what's killing our people. So thank you all for being here. It's much appreciated.
Howdy, my name is Dr. Joey Alonzo. I'm from the Texas A&M Health Science Center. I'm the chair of the Texas A&M Opioid Task Force, and in conjunction with our excellent partners here at HIDA and with other community partners to include law enforcement, first responders, the PRCs, the Council on Recovery, we are actually, one of our premier projects at Texas A&M is to proliferate the distribution of Naloxone rescue kits. Texas has done an excellent job of having legislation that supports the distribution to every citizen in the state of Texas. What we want is for every person in the state of Texas to have a Naloxone rescue kit and to know how to use it. If you've never seen Naloxone, I'm going to show you how easy it is to save a life. You don't shake it, you don't take the cap off. All you do is put it up somebody's nose. Watch this. I just saved somebody's life. That's how easy it is. Okay, we want everybody in the state of Texas to have a Naloxone rescue kit and understand how to use it. So this is our premier project. We've done this with 40,000 people across the state of Texas with no money and no resources. Imagine what we could do with more. So this is how, this is one of our premier projects. Additionally, I'm here with my partners in the community to proliferate harm reduction. To us, that's treatment. We want to get people, we want Texas to go from last place, according to Mental Health America in 2021, relative to access to mental and behavioral health care, to first place. And to do that, I need your help. I need physicians to be trained. I need physicians to get X waivers to be able to provide medication-assisted treatment in the community. Let's cut the demand of our people. In conjunction with all the law enforcement folks who are going to do this great job of, penalties and arresting and investigation, I need our people to not want to get high. They need treatment. And now the kind of treatment we need are proliferation of methadone treatment centers, proliferation of physicians that are willing to provide Suboxone treatment in the community. And in rural Texas, there is none. In 75% of Texas, there's not one mental and behavioral health resource in the entire county. That's 75%. So we need to proliferate that, and I need your help to do it. More X waivers, less restrictions, more on third-party payers, medical parity, and to help the PRCs do the important work that they do to spread harm reduction treatment to our people. As a public health initiative, you heard Senator Cornyn's office say 100,000 overdoses. That was only up until April of 2021. April! I don't even know how bad it was to the end of 2021. Texas, unfortunately, here in Harris County, we do have a lot of reporting mechanisms for overdoses. The rest of Texas, we have none. I don't know how many overdoses there are, and I don't know, as a researcher, I don't know how many non-fatal overdoses there are. It's impossible. So we need surveillance, ODMAP, as a fantastic tool to help us develop targeted interventions where they're needed, and the proliferation of treatment programs across the state, not just in Harris, Tarrant, and the Austin area. We need treatment everywhere, and it can't be brick and mortar. We have to find innovative ways to spread these excellent harm reductions. I don't know if you know this or not, but one of the major adverse effects, the adverse markers of our public health crisis is in Bexar County, the highest number of babies born with tolerance and dependence to opioids. 32% of all cases of neonatal abstinence syndrome occur in one place, San Antonio. If you want to study neonatal abstinence syndrome as a doc, that's where you go, because that's where they all are. That speaks to an undercurrent of opioid use that is so high that I have the highest number of babies being born with tolerance and dependence to opioids in one spot. So I'm going to leave that thought with you, and consider supporting all these fantastic initiatives that you're going to hear about, and support. I want to congratulate our survivor who's going to talk about the recovery journey, and we need to support these folks that have a chronic disease state and provide treatment for them. Thank you.
Good morning, everyone. My name is Judy Johnson, and I'm the Chief Development and Communications Officer at the Council on Recovery. I want to thank Houston HIDA and all of our partners here today for the opportunity to partner in this effort. It's a pleasure to be working hand in hand to raise awareness about the dangers of fentanyl. The Council on Recovery is Houston's leading provider of addiction recovery services. We provide a complete spectrum of services, including prevention, education, outpatient treatment, and recovery support. When we first opened our door more than 75 years ago, we had just a single employee and served 56 people. Today, we serve tens of thousands of individuals every year. And although a lot has changed since our founding, our commitment to fighting addiction has not changed. Awareness is essential to that fight. That's why campaigns like the One Pill Can Kill is so important. These billboards create visibility about a disease that is all too often invisible. They shine a light on the dangers of the opioid epidemic and connect parents to resources to help them keep their children safe. The Council is proud to be one of those trusted resources for parents and families who are impacted by substance use and abuse. The Council is the place to turn when you don't know where to go for help. We provide services for the entire family, not just the affected individual, and deliver compassionate, best-in-class care, regardless of a family's ability to pay. In just a few minutes, you're going to hear stories from real families whose lives have been irrevocably changed by opioids. It's absolutely devastating to know that so many of our neighbors are suffering alongside of them, each enduring their own version of the same tragedy. So I'd like to close today with a message of hope. Hope for the individuals and families who are currently suffering through addiction or who have lost a loved one to an overdose. You are not alone. Addiction is not a moral failure. It is a chronic disease, and it is treatable. Recovery is possible. It is real. And you don't have to do it alone. If you remember only one thing from today, know this. The Council on Recovery is the place to start. If you or someone you know is struggling, call us. We will walk with you, guide you, and make sure that you can find the help and support that you need. Thank you.
Good morning, everybody. My name is Melissa Romaine Harrod. I'm with the Prevention Resource Center for Region 6. And we are one of the many programs that are housed over at the Council on Recovery. I am here today on behalf of Mary Palmer. Mary Palmer is mother of Ian Mackay, who's the young man you see in the billboard above me or behind me here. Before I begin to share Mary Palmer's statement with you, I just want to say that I am truly honored to be entrusted with her words this morning. At 19 years old, Ian Mackay was full of life, love, and laughter. He loved traveling, baseball, his family, and his friends. But in an instant, and with one pill, all of this was gone. He never got the opportunity to get married, have children, or even celebrate his 21st birthday. As a family, we are devastated. His sister lost her only sibling, who was her best friend and the best man at her wedding just 3 months prior to his death. After graduating high school, Ian dreamed of being an EMS paramedic and saving lives. Ian had chosen to be an organ donor simply by checking the box when getting his driver's license, and in his death, he saved 5 lives through major organ donation. Our family would like to carry on with Ian's dream of saving lives with these billboards. There is nothing we can do to bring Ian back. However, we hope to spare another family the devastation that we have gone through. We hope that someone driving past one of the billboards will say no to a pill. They'll dispose of a pill that they already have, or simply call the number on the billboards to ask for help, knowing that the next pill they take could be their last. We all need to rise above the stigma of drugs and realize that this is happening in our communities. Drugs do not care about demographics. The worst things a parent could say is "not my child." Please educate yourself, your children, your families, and your friends, or even a complete stranger. The life saved could be someone you know, even someone in this room. And Ian's family thanks you. Now I'd like to introduce to you another mother with whom we have worked over the past few months. Colleen Fitzpatrick is joined by her daughter, Chelsea, today. They are here to share their story of overdose, near death, and recovery, also in hopes of raising awareness of the dangers and the presence of fentanyl in our communities. Please join me in welcoming Colleen and Chelsea.
Hello, my name is Chelsea Chancellor, and I'm 22 years old, and I'm a survivor of several fentanyl and heroin overdoses. My story started at the age of 13. A lot of it was self-medicating for mental illnesses that I suffer with, and that always snowballs into the disease of addiction consuming my life and traumatizing everyone else's around me. By the age of 15, I was performing CPR on one of my very close friends who ended up not making it, which led me into picking back up into my active addiction with opiates. And by that time, all opiates were laced with fentanyl. So in the span of 7 years, I've had several, up to 14 at least, hospitalizations and overdoses needing Narcan. My mom has performed CPR on me several times. One of them was from just one pill that I took that was laced with a deadly amount of fentanyl. And they didn't think I was going to make it. Several times my mom has gotten that phone call that they don't think I'm going to make it. And I'm here today, and luckily I have 7.5 months in recovery. I owe a lot of that to the Houston Heroes program. It's a Houston opioid epidemic response team, and I'm blessed with a beautiful counselor that helps me get through this journey. I'm not alone, and one pill can kill, and one voice can change the stigma attached to all of this, and it can save a life. So, thank you.
Hi, I'm Colleen, Chelsea's mom. And just briefly, I just want to say thank you to Mary for being so strong and able to help us with the billboard campaign. This is an epidemic in our nation, and we need to educate and communicate with our families, with our children, with the people that we work with, people in school, wherever. It's not going away. It's just getting worse and worse. And because of Chelsea's addiction, I am now on the leadership committee for the Behavioral Health and Suicide Prevention of Montgomery County. And we've had this organization for 3 years now. And again, all the statistics that have been mentioned are true and growing. And I just want to say that my journey with Chelsea, emotionally, like she said, is sleepless nights, dreading that phone call, and having to perform CPR on her to make sure that she survives until the EMS gets there, to administer the Narcan, which I carry Narcan in my purse. I carry it everywhere I go. It's like American Express. I don't leave home without it. And you just never know when you're going to need it. And you've seen how easily it is to administer. And Chelsea's survival right now, the last time that she had used was July 29th, 2021. And she decided to get behind the wheel of a vehicle and was in a horrific accident that I got a phone call at 3:30 in the morning saying that she did not survive and that I needed to get to Memorial Hermann in the Med Center. And we live in Montgomery over on Lake Conroe. Probably the longest drive of my life because I thought my daughter had not survived. But when I got to the hospital, when I got to the emergency room, they said that they did not give up working on her in life flight and that she was in surgery and that she was going to make it. She was in the hospital for 30 days with numerous shattered bones. Her scalp, she had been scalped, her left ear had been severed off. Crushed left wrist, shattered jaw, and from her knees down, she was, they were shattered. So being here and being honored to be able to communicate our story means so much. And all I can say is please communicate, educate, and help in any way you can. Because, like I said, it's a national epidemic and we need help. Thank you.
All right, we're going to take some questions. And actually, I'd like to ask you all a couple of questions before you go. First of all, I'm so sorry that you went through that. I can't imagine what that must be like as a parent to perform CPR on a child. How much of an uphill battle was it for you to learn about this? Like, what did it take for you to find Narcan, to keep it in your purse, to find all of these resources to help your child?
That was when we started the Behavioral Health and Suicide Prevention Committee of Montgomery County, and that, we're all well aware and we're out in the community and we're educating and making sure families have resources for their loved ones that are struggling with addiction. And
was it easy for you to find resources?
It is. All you have to do is pick up the phone and we can direct you depending on what your needs are. Mosaics of Mercy is one of our main resources that you can call. And even throughout the state of Texas, they will be able to direct you to the right people that you need. And unfortunately, with this epidemic after COVID, there's a shortage of facilities, counselors, doctors, and we seriously need them. And that's our biggest challenge right now, is finding a bed, finding a place for them to go, and a good fit. There's different resources, but you just have to find the right one for you. And Chelsea finally did find the great one for her with Heroes.
Have you asked any politicians for help on this?
I have. And actually, the leader of our commission is Judge Wayne Mack of Montgomery County, and he is doing his due diligence to get to Austin and speak to the people that we need to be in touch with. And we would like to join forces with these people and just create more awareness.
Chelsea, would a billboard really have changed your mind?
It would have, honestly. Given my own experience with, there's a billboard in Dallas of a really close friend of mine who lost her life by taking a fake pill, just one. Just having that knowledge, it's really scary to realize that that's the harsh truth and reality of this addiction, of this disease, of the reality of what these people are doing to try and make money at the cost of your life. It does make you stop and realize, like, just one pill, you know, hearing about 2 milligrams and comparing it to a packet of sugar being 1,000, that it just really makes you focus in on how serious this is. So it has really, it just keeps it like a blunt reminder of how real and serious this can be, and just all it takes is one pill, and that could be the loss of someone's sister, best friend, brother, parent. It's just the harsh reality of it.
How old were you? How old are you now, and how old were you when you first began using?
I was 13 when I started an active addiction, and I'm 22 now.
And my last question for you would be, this is going to be on the 5 o'clock news today, prime time for parents who may think, I would totally know if my child was using drugs or buying these pills. To the parents, you say what?
If you see something, say something. You know, I'm not saying that no one can raise their kids right. It's not even about, I think a lot of parents take it like a blow to their ego. I raised you better than this. I've taught you better than this. That's not the case. It is a disease. It is a mental disorder that we suffer from. It's either we're predisposed to it, or all it takes is one hit, one experiment to activate that, and then you're completely helpless and out of control over it. And it's not something to brush under the rug and think, oh, it's just a phase, or oh, they'll get over this. You know, you have no idea what's out on these streets, no matter how much you think you do, no matter how good you think you raise your child. It's a disease. And if you see something, say something, and you need to be as proactive as possible, because it can happen to you. That could be your child or your neighbor on a billboard, and unfortunately with several people, it is their child on a billboard. It is their best friend on a billboard. It's something, no one is immune to this disease. So do anything you can, even if your kids have never even experienced, no matter what, carry Narcan, take a class, learn something, help someone. You know, just, there's always a yet at the end of everything is what I've learned in my addiction. Oh, I could never do that. Well, there's a yet at the end of a lot of that. And you just, you don't know what's going to happen tomorrow or tonight, or as anyone gets older. So be as proactive as possible. Don't be naive. Don't take it like a blow to your ego if you think your child is doing something that you just would frown upon or not be proud of. They need help. Better safe than sorry. You don't ever want to be too late and think, looking back, that you could have done something different, because there's so much that you can do.
Chelsea, did your mother ever confront you at 13? Did she notice anything?
Not at that age, no, because I wasn't taking it to the extreme. Eventually, you know, as I was getting older and the way I was using it, and especially what I was using, you know, parents work. Kids that go to school, you know, we're not by each other's side 24/7, and that's okay. It's not saying you have to babysit your child, but being that young, I was very naive about what was going on. I didn't even think I had a problem. You know, I didn't think it was a bad thing. I was trusting someone very close to me, and thinking they would never let anything happen to me. You know, this is obviously okay because she's doing it, so I can do it. So no, but once it did get to a point, by 15, 16 years old, it was definitely well known, and it was addressed, and it's been, you know, she's chased down dealers, she's chased me down in a car, she's gone banging on doors, you know, posting pictures, saying, hey, this guy, this person. She's done everything. Once she knew what she could do and that she had to do something, she did do everything.
Good.
Yeah. Thank you.
We'll take some questions, and then we have the speaking person after the questions, so I know they don't. All right, any questions? You guys go. I'd like to speak with a doctor from Texas A&M University just for some clarification. Sure. Because I'm scratching my head because you did this great demonstration with something that looks like Flonase, which I took today for my
Let me grab it again.
for my allergies, and you're talking about
It actually does. It's easier to use than Flonase.
Yeah, can you demonstrate that?
I absolutely can. So this is a Naloxone rescue kit. It contains 2 doses of Naloxone. The brand name of Naloxone is Narcan. So this is 1/10 of a milliliter of fluid. 1/10 of a milliliter. That's how small, and it's very effective against ultra-potent opioids like fentanyl. You can see, just take it out of this package. You don't shake it. You don't do anything. You know, you just put it up your victim's nose, and here it is. Just like that. This is active drug, unless you had your heroin dose this morning. Won't bother you at all.
Who pays for that? Who pays for those kits?
So this actually came from the Texas Targeted Opioid Response Grant. It was a block grant to the state of Texas from SAMHSA, the Substance Abuse and Mental Health federal organization. Our TTOR grant's just running out. Right now, we actually, all of us here that actually actively give out Naloxone rescue kits are out. Everybody's out. So what we're doing, the opioid abatement settlements are just starting to roll into the AG's office, to the Attorney General's office, and we're lobbying very hard to get Naloxone rescue kits as a major feature of the expenditure of this money.
I don't understand why you have to lobby if everybody acknowledges that it's an epidemic, that babies in Bexar County are being born with an addiction to drugs.
Well, just like you didn't actually, have you ever held one? Have you ever held one in your hand?
Harris County Sheriff's Office.
Once. Do you have a kit of your own?
I don't.
There you go. That's why. I mean, right now, there's just not enough education and awareness about Naloxone rescue kits in the community. We need to have, you know, Chelsea's mom, right? She should have had one from the get-go, right? As soon as we identified that there was risk in the family. Not only that, Chelsea should have one. And she should be able to give it away to anybody that needs, you know, anybody of her friends that may have risk as well. We need to have this be just like Flonase in the community. We need to have CPR. That's a nationally recognized rescue procedure, right? Nobody has any trouble saying like, oh, you should be CPR certified. You should be Naloxone rescue certified. We got to.
Law enforcement in Texas?
Not yet. These guys in Houston do, but 75% of Texas is rural, and it's expensive still to this day. The retail cost of this little kit here is $125. Even at the special discount price of $75, still kind of expensive for a local PD in a county like Milam County, say, in central Texas, that has a small PD unit. It's not a line item in their budget. They can't afford it. So this opioid abatement settlement, we have to make sure that every PD in the state of Texas is equipped. Every first responder in the state of Texas is equipped. Every single EMT units pretty much have it, but volunteer firefighters don't. And there's entire counties where there's not one professional rescuer. They're all volunteers. We have to make sure they have it, and better yet, know how to use it. I tell this story all the time when I do naloxone trainings across the state of Texas. I've done several of them in conjunction with HIDA, that Prince died in his own elevator, and his bodyguard had naloxone rescue kit and did not use it because he was not trained. So it's not good enough to have it, you have to be empowered to use it.
And I overheard you saying, and you go into high schools and you train kids how to do this?
I did. I just recently, we went to Conroe High School to the Magnet Health School there. There's a health professions magnet school there. Every bell from 7 a.m. in the morning until 3 p.m. in the afternoon, we trained just continuously, every 45 minutes, trained kids at Conroe High School. It's the first time we've ever done that in Montgomery County, first time ever. So, but we need every school nurse to have it. We need it to be policy on all campuses. I actually, through the TTOR grant, even the mighty Texas A&M, we supplied naloxone rescue kits to our own UPD through the TTOR grant. It is not a line item in their budget.
And how long has this medication been around?
Since 1961. Oh, it's not
I'm
new.
just trying to paint a picture of like, it's been around for a while, no one knows.
In any ER, I have
$125 you can save someone's life.
$75 for for health agencies, but and if we bought like shiploads of it, which we need, the cost would go dramatically down. So but this is something that every firefighter, every PD, every UPD, every campus with any kind of student anywhere. You heard Chelsea, she started this when she was 13. That's middle schools, not just high schools. maybe elementary schools, but we need awareness throughout, and we had the HIDA representatives and I had a fight to get it onto Conroe's school district. We had to go before the school district and say, like, this is actually, Texas A&M has been really supportive of this work. This is actually every health science center student, every single one that darkens our door, every medical student, every nursing student, every pharmacy student, every public health student, they all get this training and they are all issued this kit through the TTOR grant. Now that that's kind of running out, we're going to figure out another source of funding to do that. But the whole idea there was to breed a new type of clinician who was well-versed in this and had seen it, held it, holds this, carries it in their backpacks. So we're just not there. And awareness campaigns like this, and we actually, with the help of HIDA, we're going to put up the first billboard in the state of Texas that says, carry naloxone, save a life. There are none that I know of.
Maybe you should get a billboard.
Yeah, that we're going to build the first one. It hasn't, this idea is harm reduction. This isn't treatment. This is live to fight another day. But you got to live to fight another day. You just heard that, right? From the survivor. And, congratulations to her and her family for making it to this point. They fight every day. They recommit to their recovery every single day. And we have to walk beside them and be prepared, right? So there's just not enough awareness. I'm going to actually give it one of the kits for Senator Cornyn himself. And anybody here who needs a kit, if you don't have one, I'll get you one. If I have to pay for it myself. So everybody here that's fighting this fight, you have to have one. I myself, and I'm sure everybody at the Houston Council on Recovery, have had to use my own kit at least 15 times. Just by, once out in front of Houston Northwest Medical Hospital.
So which law enforcement agencies do have them?
The Houston law enforcement agencies do. In major metropolitan areas, they have a budget for it as a line item. 75% of Texas is not metropolitan. Most county by county, in the rural counties, you don't have to go far to be Orange County, let's say, to the east. Let's see, to the north, Washington County, Burleson County, Milam County, Bell County, San Saba County. Those PDs do not have a budget to carry naloxone rescue kits. Actually, I keep getting emails from people, they expire just like all drugs do, and to replace them, I keep getting emails from small PDs to be able to replace their naloxone rescue kits. And right now, until I get funding from the opioid abatement settlements, I don't have that funding to do that. So we're hoping, against hope, to get funding to be able to distribute this throughout the state of Texas. And Texas A&M is committed to this. Our legal department, our leadership, along with the Attorney General's office and TDEM, the Texas Department of Emergency Management, we're committed to providing every single PD and every single firefighter throughout the state of Texas with naloxone rescue kits.
So just to be clarified, the last legislative session, they boosted the charges for people who manufacture, give out fentanyl, but there was no line item for this.
Not yet. So, thank you.
One question, where are the billboards located?
I'll let the HIDA folks talk to that.
Do you want to talk about billboards?
They're strategically being located all throughout north, south, east, west, and there's more going to be going up right now. I think there's 13 billboards going up all over the city, and we've got some more. Just some discussions we've had with all our partners here this morning. We're going to inundate some of the areas even better. And then I'd be amiss to say the reason that South Texas and North Texas, or Texoma HIDA, are here today, we're actually doing this jointly between all four Texas, and you'll see some of the signs that are displayed up in different parts of the state, and we're going to get this as an outreach to everybody. And one of the things that we keep talking about is we talk about the pill, but we're encountering fentanyl mixed with some insane like methamphetamine that's supposed to make you high. What does fentanyl do? It actually it's a depressant, and then the worst cases I keep hearing about is the traffickers are putting fentanyl in counterfeit Adderall. So you think of a college student that's taking Adderall because he's going to want to stay up, or he or she's going to want to stay up all night. They take Adderall, and there's no Adderall in there. It's just counterfeit fentanyl, and the whole reason the traffickers and the cartels are doing this is to get everybody hooked. And I really want to also thank Lee Vela with Clear Channel. He is providing these billboards to us digitally and physically at a really reduced cost, because it's something that he actually believes in, and what a partnership that we all can do, and we're gonna really inundate this across the state. And for everybody here, I would really encourage you to get with Wendell or Bill Stevens back here. Bill, raise your hand, please. Go and zone in with the help of Harris County EMS and with City of Houston EMS with Dr. Purse. We are actually live in Harris County, but when you zoom in on that OD map and you see that the little star triangles are actually a death, you're going to be shocked why this is such an urgent issue for now. And I really thank you guys for getting out here and helping us get this message out.
Can you give us a specific location of the billboard? They're in the press packet. It is. Yes.
If I can just
Please.
add.
Thank you, Lee.
Yeah, no problem. Thank you, Mike. These billboards are going up now as we speak, and they will create, in the first segment alone, 14.3 million market impressions throughout the area. So this campaign is not only in Houston, but it's in Dallas, as you see the lower design, and then also in Oklahoma as well. So I also serve as president of our state association, the Outdoor Advertising Association of Texas. And Mike, we're committed to help you, not only in this region, but throughout the state of Texas. So it's one of the things we believe in. It's affecting our communities. And we're happy to, not only this first segment, but to extend what we're doing in this first segment at no cost at all. So we're very pleased to be a part of this on both our digital billboards throughout the area, and then also on our traditional billboards as well. So each one of these, I think there's a list of where they are in your press packet, so that throughout the area, and immediately you will start getting calls. So we're pleased to be a part of this whole effort.
So, ¿por qué es tan importante tener estos billboards activos para enviar un mensaje?
I don't do it.
Right. I heard you speak in Spanish.
No, not me.
¿Por qué es tan importante? What is the message?
Well, the message is, obviously one pill kills. And if we can get through to one person, save one life, it's all worth it. So it's an education process. I think you've heard today from the various speakers that it's recognition that this is an epidemic, this is a problem. And being out with these messages on the streets is a way to bring up the awareness of this whole issue, not only with the campaigns are to help save a life, but also to recognize that talk to your children, find out what they're doing, make sure that they're not involved in some of these things. So, we do a lot of programs with human trafficking as well, and so we know that works as well. We had a 33% increase in the number of calls through the human trafficking campaign once the campaign started. So we know that you're going to get a lot of calls from this, and so hopefully people will find help, recognize it's a problem, and go from there.
All right.
Okay.
Is with DEA, you can only talk about DEA stuff, not anything else, in Spanish.
Sí, las carteleras son una manera en cómo la DEA está combatiendo el problema que tenemos aquí en la área de Houston, la crisis de fentanilo y cómo está afectando a nuestra comunidad. En Texas, la oficina de Houston tiene 12 oficinas bajo de la oficina en el sur, este y centro de Texas, que en las 12 oficinas hemos decomisado 45% adicionales fentanilos, decomisos de fentanilo comparado al año pasado, en este mismo tiempo del año pasado. En el condado de Harris, los sobredosis de fentanilo ya han sobrepasado las sobredosis de cocaína que del año pasado. Esperemos que las carteleras puedan salvar una vida, porque sabemos que una pastilla puede matar. Las pastillas son mezcladas con fentanilo, son producidas en laboratorios clandestinos y son contrabandeados acá hasta nuestras comunidades para causar daños acá en los Estados Unidos. Y muchas de las veces las ventas de estas drogas son por el internet o redes sociales, y en cualquier momento alguien puede estar comprando estas píldoras falsificadas que están mezcladas con fentanilo, que pueden ser tan peligrosas.
¿Qué le quieren decir a los padres de familia sobre el riesgo de que sus hijos puedan encontrar este tipo de pastillas? Niños de edad de primaria o escuela intermedia.
Sí, los padres tienen que estar más envueltos en las actividades de sus hijos, en las actividades de sus celulares y qué comunicaciones están teniendo con sus hijos y los traficantes de droga, que es posible que sean.
How about parents that consume themselves and might accidentally put something accessible to their own kids? Have you seen any kind of cases like that? I mean, parents or a member of the family that is addicted to certain kind of groups or that take these kind of pills or buy pills, counterfeit pills, and maybe a kid
Sí,
can accidentally access that,
sí, seguro que hay casos que cuando los padres puedan tener estas mismas drogas en su casa, en sus hogares, que sus hijos se pueden accidentalmente ingerir o tomar esas.
Eso puede ser otra manera en la que eso puede suceder, ¿no?
Sí, claro que sí. Es para que los padres tengan más reconocimiento de lo que puede estar pasando con sus hijos.
Okay, thank you guys so much.
Thank you, guys.
Thank you, great job.
A lot of interesting committee and so